Hello, it's another day here with us on Afya Health and Lifestyle Interview Series. Welcome you to this new episode. And on this episode, we'll be talking about oral health in the spirit of the World Oral Health Day going on around the world right now. And with us, we're going to be having Dr. Ben Arogunre join us live. And before we bring him up, I would like us to get to know him better.
He had his primary and secondary education in Lagos between 1977 to 1983 and 1983 to 1988, respectively. Dr. Arugure got his master's in public health, MPH, University of Port Harcourt, 2019, PhD candidate, Health Systems Management, University of Port Harcourt, 2022. Dr. Agbari was once a medical officer, dental clinic, medical division, Eastern Zone, Nigerian National Petroleum Corporation, NNPC, Port Harcourt, April 2005 to January 2010. Worked at the dental department, Niger Delta University Teaching Hospital, Okolobiri, Bayelsa State, March 2010 to June 2014. Head of Dental Department, Diante Koki Memorial Hospital, Yanogwa, June 2014 till date. He has won numerous awards and also member of many organizations, including NMA and NDA.
All right, so I want to introduce Dr. Arogunre to us. Let me bring him up now. Good day to you, Dr. Arogunre. Welcome to Afya Health and Lifestyle Interview Series. We are really excited to have you here. And in the spirit of the World Oral Health Day going on, we hope you'd be able to shed a whole lot of light on oral hygiene and oral health generally. Do you want to say hi to our dear viewers?
Hello, viewers. It's nice to be here. I'm privileged to be on the platform of Afya, Health, and Lifestyle. Thank you for inviting me. Good day, everyone.
You are very welcome, sir. Thank you for joining us. Without wasting time, I want to go straight into the business of the day. When we say oral health, in general, what are we talking about?
When we say oral health, it goes without saying that oral is talking about the mouth um, uh, and structures within and without daring. We're talking about the purview of the lower face, uh, the jaws as we know them. We are talking about uh, the business of head and neck, especially the aspect that has to do with the specialty of dentistry and dentists worldwide. We are talking about the orodental structures, not just the teeth, but structures that keep the teeth in place, um, periodontium, the tongue, the buccal environment, the and all other structures that lie within the oral cavity, their health and disease state, as well as their optimal functioning uh, for the service of the human who owns them.
Thank you very much for that brief explanation, sir. Um, the purpose of this interview is to make people, Nigerians to be specific, more interested in their oral health. If there's one part of the health that Africans and Nigerians in particular do not take very seriously, it is going to be mental health and oral health. And we're here to discuss the oral health. So, aside mouth odor, that is what is called halitosis, and toothache, or I want to remove my teeth, what are the important things to take note of as regards one's oral health?
Okay, you said aside mouth odor or halitosis or fetor oris, fetor ex ori, or bad breath, whatever nomenclature we chose, and the feet was the other things that may constitute the oral health. And that's a solid, that's a rare question, yet a very pertinent question because it appears like a crazy venture for somebody to spend 6 years in school studying just the teeth. And Oluwaremilekun has succeeded in removing the teeth out of the picture. You have removed the teeth, my my moderator and presenter. You have removed the teeth now out of the picture, and removed one of the issues that bedevils mankind, mouth odor or halitosis, as it were. You've also removed that out of the picture. So then you leave the dentist in what people may think is a quagmire, but in actual fact I love that, because then you begin to see what the role of the dentist is, and it goes beyond the tooth or teeth, as it were, and the structures that make it up, and the entirety of the dental profession, from which the entirety of the dental profession, and the name. Um, how would I put that now? I was going to say that the entirety of the dental profession seem to have derived um, its relevance from the teeth. That's the point I'm making. The entirety of the dental profession has derived its relevance from the teeth. But now, very wisely, for the first time since I've ever been interviewed, I've attended in this week alone about 3, 4, 5 interviews, and you have removed the teeth out of the picture. And so, what is left? And that's lovely for me, because you have what we call the periodontium, the structures that hold the teeth in place. They are not just bone, first bone, what we call the alveolar bone, but there are also fibers. There is the gingiva, the gum structures. Some of them are technical. They may appear too technical for our listeners, ultimately listeners who are not trained in this light. Um, they are still there in the mouth, and they sit on a basal bone. In fact, I dare say that the essence of the basal bone, it's because properties, entities like the teeth sprout out of them, erupt from them. So you will not be talking about a jawbone, for instance. If something doesn't sprout out of it, it's a fertile ground from which the teeth sprout. So when you build the dentist world around just the teeth, or the dentist world seems to be built around the teeth, yes, a huge portion of his profession has to do with the teeth, but there is much more to life than that for a dentist. Okay, it is important that the health of those jaws, and I mentioned them in plural because the teaming public do not even know to start with that we have two jaws. When you talk about the jaw, they think of the lower jaw that is movable.
Just
You have an upper jaw, and you also have a lower jaw. You have structures, periodontium, a family of elements that keep the teeth in place. You have the inside of the mouth, the inside lining of the cheeks. We call the mucosa. You have the tongue, which is one of the most, if not the very most powerful muscle in the entirety of the body, in that same place. You have the pharynx, the oropharynx. Okay, some of the properties therein within the purview of the dentist. You have the tonsils, and so on. So, for instance, when you now also talk about halitosis, and which people call mouth odor, you find out that the term mouth odor is a misnomer, because the odor, first and foremost, may be coming from places other than the mouth. Okay, the pharyngeal spaces are there, the nasal passage is there. Okay, maybe coming from the lungs, wherein somebody has a one lung infection or the other. It may be coming as a result of very volatile substances like spirits, alcohols. These things are volatile. They come out from the breath, released from the lungs of the person, which can ooze out from either the mouth or the nostrils, which is the main function of the nasal passage. But you now call it mouth odor, because that stench from somebody who has taken alcohol or beer and all of that, which comes out as odor to another person. Okay, is not coming from the mouth. The mouth just appears to be a pathway, a passage, a road, and then you call it mouth odor. So that's a misnomer. Okay, and then there are issues where times where things are coming from deep within the GIT, and so you need multidisciplinary approach to handle such things. And then we still talk about mouth odor. How is that mouth odor? And it just happens to be a pathway, a passageway uh, for such obnoxious odors, but it doesn't necessarily. It has not necessarily emanated from the mouth.
All right. Thank you very much, sir. Um, the most common issues people generally have with their mouth is usually the mouth odor and oh, I have pains in my teeth. That is why I asked the initial question that when we take out those two, what else is there? So we are now going to come down, Holmes, because this is what is most important to our viewers. The best way to attack these things will probably seems the preventions. So, but people need to understand what causes, just like you have explained that mouth odor may not even necessarily be coming from the mouth, it can be coming from anywhere. And a lot of people don't know this. Um, that is why there can be a whole lot of stigma attached to it. So, what should people actually know about this thing called the mouth odor? And what are the things they need to do to prevent it?
Okay. Before I answer that, I will still want to hammer on more on the issue of taking out the teeth and mouth odor itself and what is left for the dentist. In fact, if we take it in logical sequence, you will find that you start from the lip outside, just outside the oral environment, the circumoral musculature, as we call it, the lips. Okay, somebody can you can either trauma to the lips or cancer of the lips, okay, as a result of consistent assault, maybe from smoking or chewing certain nuts or exposure to ultraviolet rays and so on and so forth. Okay, constitutes areas where the dent falls within the purview of the dentist first and foremost before he refers to dentists who specialize in surgery in that area, the maxillofacial surgeons, as we
So,
refer to them. The jaws themselves can suffer several things. Okay, since we have taken out the teeth, then maybe 80%, 90% of the issues are gone. Okay, but there are still many tumors of the mouth. There are the ones you will classify as odontogenic tumors, meaning that they have resulted as they have come up about as a result of things that have to do with the development of the teeth. Okay, but there are also many that are non-odontogenic, so that if you remove the teeth, there can still be issues with those areas, okay, pathologically speaking. That is not also to mention, that is not to mention even the issues of trauma that can bedevil that area. For instance, I'm having a case currently, and I've referred to the facial surgeons appropriately, of fracture of the jaws as a result of trauma. Okay, wherever you have bone, it is liable to fracture. The propensity for fracture may differ from bone to bone, person to person, situation to situation, but suffice to say that if it has bone, then the bone can break. It just needs the right proportion, amount, or severity of blows, either from a fall or fisticuffs exchange between humans, and so on and so forth. So you can still fall within the purview of the either in the lower jaw or in the upper jaw. RTAs, road traffic accidents, domestic brawls, etc., etc., can cause problems there. Okay, and then there are cancers of any part of the, or let me put it in a better way, tumors. Okay, 2 months of any part of the oral environment, the lips, like I started to say, the tongue, okay, the mandibular basal bone, maxillary bone in the upper jaw, okay, the nasal pathways. If it links to the oral environment, then it will be a division of labor between the ear, nose, and throat surgeon and the maxillofacial surgeon, who is primarily a dentist. Okay, the hard palate, the soft palate, pathologies of any such area. For instance, a friend and a professor of craniofacial dentists is Professor Butali Aziz, who is world renowned in craniofacial genetics. His business is to find out what hereditarily speaking, genetically speaking, um, 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 is are what are responsible for malformations, misnomers, aberrations in the formation of structures of the craniofacial complex. By that I mean structures that have to do with the head, face, and oral environment, and so on and so forth. Okay, that's he has made that his purview. Okay, investigating what causes such aberration. Why would somebody, for instance, have a cleft lip or a cleft palate? What will cause that with regards to the genes of the person? Coding, can I say wrongly? Permit me to say coding inefficiently or ineffectively or wrongly outrightly, such that the person's lip does not close, the person's palate is not closed at the point of birth, and then there has to be surgical intervention. All this constitutes the oral environment wherein the dentist has made his purview, and we are still not talking about the teeth at all. We've removed the teeth as you have asked us to. I come back to your question, which was about is this still on halitosis? Your question.
Yes, sir. Yes, sir. So the question is,
Well,
halitosis being a
yes,
very common thing among Nigerians. So we want to talk about
yes,
the causes. You've already mentioned how it doesn't necessarily have to come from the mouth. It can be from anywhere
yes.
in the oral cavity or even deeper. So can you shed more light on things that can cause it and how to prevent it?
Oh, okay. Um, halitosis itself is, uh, in my own words, sometimes unpardonable or objectionable, obnoxious, odors from the mouth, um, emanating from the airway, from the nostrils or from the mouth. You remember we said mouth odor, and that it may be a misnomer. And these odors as a result of several factors. There's the physiological halitosis, which if we will break down, it just means natural mouth odor. Natural, if you will permit me to say, necessary mouth odor. We are humans, organic and biologic elements, and therefore you go to bed in the night, you wake up in the morning, and the mouth has been stanched, been closed for a few hours, and you wake up in the morning, and there is this odor that is enough to knock down a whole battalion of the Russian army. You know, Russia and Ukraine are at war now. So, and then you don't need lethal weapons. The mouth odor is enough to knock down the enemy. Anyway, I just meant that by the way as a joke. So this one is physiological, it's natural. You wake up in the morning, you arm yourself with a toothbrush, put some your paste on it, and brush your mouth painstakingly, thoroughly, uh, gently, for maybe about 5 minutes or a little bit more. Not the one we do for 30 seconds, 1 or 2 minutes as we rush to work. No, it won't work because you will not have done a thorough job. There is a high possibility that you didn't do a painstaking thorough job, or you thought you did a very hard job, but you ended up injuring yourself. And the injury is such that it is there, but you don't notice it. Okay, so once the toothbrushing is done, the oral hygiene is affected. There is the 99% likelihood that whatever the natural mouth odor that is there that comes with the human activity of eating, sleeping, waking up in the morning, and all of that normal physiological activities, that one will go away, and then you can face the public in your office, school, or wherever. Okay, okay, so that's natural physiological. Okay, then we have the genuine real halitosis, which is a function of anomalies or pathological processes going on within the oral environment or around it. So 90% of or more of the odor we are talking about emanates from the oral environment. The first thing the patient wants to do, or any enlightened person wants to, is to refer you to a dentist. It's natural because that's the purview of the dentist. And why would that be? A person's oral hygiene is poor. He has never been to the dentist to have some checks, and they do what we call scaling and polishing for him.
Pollution.
Uh, um, um, Hygienic interventions to clean away plaque and calculus tenaciously attached to the surface of the teeth. Calculus, which is laden with heavy, heavy duty bacteria, food remnants, sloughed, dead cells from the mouth. We call it from the epithelium from the mouth, and of course calcium deposits from saliva. Saliva itself being an ultrafiltrate of blood, carrying this calcium and depositing them. You remember secondary school chemistry, when it rains on a building that has a decking but it has not been roofed, and then when you look under the decking, you see white crystals attached to it.
Stalactites and
Correct. Stalactites and stalagmites. Is as simple as that. Stalactites and stalagmites. Those crystals are simply calcium ions. Where are they coming from? They are from the cement. Deckings are heavily laden with cement. Cement is
yes.
itself in turn heavily laden with calcium element, calcium ions. So the water percolating through the decking carries along with it calcium ions, and when it gets to the other side of the decking, they deposit, and the deposits over time form that, because the decking acts as an ultra filter. You see white crystals of calcium ions. By the same token, there are crystals like that. The calculus mimic crystals of calcium ions deposit, but in its own case, it appears discolored, yellowish, brownish, creamish, darkish, sometimes greenish over time. Why? Because of the constituents therein, food particles, debris from the mouth, dead bacteria, dead mouth tissues, and so on and so forth. Pigments from food you are still eating on a daily basis. It takes on them, and that forms its the coloration it has at time. So all of that over time, don't forget there are dead cells there, and there are dead bacteria, and there are dead factors from the blood that have tried to fight the local infection, local inflammation, that or local disease or local inflammatory disease that the calculus that is forming on your surface of your teeth has started to generate, has started to cause. Okay, this calculus, because of its constituents, it irritates the gum a lot, and before you know it, the gum begins to swell. Before you know it, fighting soldiers in the blood. I just named them that way. We call them the white blood cells. There are elements or factors within it that come out to fight this disease, and in the process, some of these soldiers die, and these dead soldiers form part of the constituents of this calculus. So you see, the calculus contains all manners of dead things. So, and if it contains all manners of dead things, little wonder that it will stink really badly. If I when you remove them, one of the things I do, having first taken the permission of the patient, is to hand them the calculus. Please feel this, because they don't know, they don't know what's coming out. They don't. If you just do the scaling and polishing for them and they go, the bad habits will continue. It will not be the fault of the patient. You did not carry the patient along to show him and let him feel, let him participate, let him realize what's coming out of his mouth. So I take some of this and say, please, I ask for permission to do that, and the patient gives me permission to go ahead. So I tell the patient to feel it. They feel it, and I ask them, what does it feel like? They tell me it's very hard, it's stony. And I say, okay, to rub it against your skin. What does it feel like? Wow, it's hard and sharp. It's almost cutting. It's hard and sharp. So, these are stone-like, something that has calcified properties. I say, lastly, please permit me to do this. I don't mean to embarrass you. It's coming from your own body, your own mouth, so that you understand the danger you have been harboring all this while. If you don't mind, sir, ma, would you please perceive it? Try and bring it closer to your nose and perceive it. And they do, and they are shocked to their marrow. They are shocked to their very marrow at the stench emanating from the calculus the dentist or his dental therapist has just removed from their mouth, their own mouth. And rather than be embarrassed or get offended, they are overwhelmed with gratitude, with appreciation for what you are doing and how you are taking time to educate them. And they are your patients for life. They keep coming. They want to do something about. They just literally get converted. So when you do that, you've removed it. So that's for the physiological one. So no, not physical. We've talked about the physiological one. This is for the first things first with regards to what can go wrong in the mouth and with mouth odor, poor oral hygiene, and the attendant uh, presence of calculus, and how they can be removed in the clinic, and what constitutes the calculus, and how the gums can be inflamed, and the gum diseased, and the gums begin to bleed, okay, because all of these were not removed by proper daily hygiene or consistent visit at the dental clinics for their removal. When you step it further, what can cause bad breath in the mouth? Any sore in the mouth that is infected. The mouth is a bundle of hard and soft tissues. So there is the mucosa, the cheek there. There are the gums there. There are the tonsils. There are parameters. There are elements at the back of the tongue, at the back of the throat, that help mop up infection. I'm trying to look for the easiest way to explain them. Mop up the infection around the head and the neck. They help to drain what we call the lymphatics, okay, to simply put it that way. And when there is any infection going on around the head or and the neck or the mouth or the jaw area, they tend to be inflamed. You see this more in children because they are still new into the world, and they are still trying to cope, and they suffer. They are bedeviled with a lot of exanthematous fevers, and their infection control mechanism is daily on the guard. It's always on the edge. And so the tonsils in children are huge. They are bigger. Pediatricians will tell you deeper and better about these things. But suffice to say that when they are overwhelmed with infection and begin to ooze spores themselves and all of that, they start to ooze objectionable, very offensive odors. That can constitute the reason for halitosis. Of course, you have the big one, which is our purview, mainly the teeth. When you have holes in them, as a result of we say the unbridled control of foods and products over processed or factory processed products that are instant on sources of refined sugar, or from which bacteria can easily get a refined sugar after a little activity on it. Okay, these days we are taking more of westernized diet, and the sugar, for instance, comes under about 61 different labels. For you to see sugar outrightly mentioned on any food label, note that that's just one. There may be several others on that same label, but that is not referred to as sugar, but in the long final analysis is actually sugar. And we live in a modern world, and those are the things we are consuming on a daily basis. Apart from the non-communicable diseases that they may cause, my purview is the oral health. They are a culprit with respect to cavitation of the teeth, dental caries. Okay, when these things are taken in an unbridled manner, okay, simple bread, even your gari, can cause you have caries in the way you handle them. You chew, and these things are sticky. Plantain, you chew, they are sticky, they stick to the surface of the teeth, and you don't brush after. That is the basis for superior knowledge that says that you should brush after meals, morning and night. The essence is to remove food particles stuck onto the rugae, rough surfaces of your teeth. The same rough surface which has the positive advantage or function of helping you to grind food. Its drawback is that it has crevices within on it, crevices there where sticky foods like bread, like plantain, fried plantain, for instance, can stick to. And when your oral hygiene practice is not painstaking, thorough, and gentle to get results, rather than the rush we do in a city like Lagos, we want to get to work by 5 a.m. or 6 a.m. in the morning, you end up leaving them there. Bacteria feeds on them. It's looking for sugar, eventually gets the sugar. By the time it gets that sugar, your the surface of your teeth are softened enough for them to be cavitated. You now have holes in them, and this is a vicious cycle that repeats itself year day in day out for several years, and before you know it, the person has several holes in the teeth. The pathology of that of the dental caries itself is such that the tooth or teeth in question can ooze very offensive odor. And there is the issue of the diet itself. If you're just eating suya, the odor from the onions in the suya, or the fact that it's beef that was roasted, can ooze an odor that is offensive to another person. One big culprit
So,
is garlic. People take garlic a lot because of what they believe are its health or medicinal values, but it's volatile, and before you know it, it shows in their breath. You can easily pick it that this person has eaten garlic, and it's offensive to some other. So the apart from the issues of the mouth itself, the kinds of food you take can be so volatile enough to ooze odors that constitute halitosis. And
all
finally,
right.
for halitosis, you can have the halitosis that is psychogenic. The person does not have the mouth odor, but he thinks he has it. Okay, he thinks he has. In fact, there are two kinds. There is the one wherein the person thinks someone else has mouth odor, whereas in actual fact he is the one that has the mouth odor. Okay, the halitosis. And then there is the other one wherein the person in question has bad breath but does not know he has it. Okay, he has the halitosis but does not know that he has halitosis.
All right. Thank you very much, Dr. Arogunre. Um, Now, rounding up, we want to talk about prevention because at the end of the day, what is important is what we can do on our own to ensure that, excuse me, to ensure that we have a generally better health, oral health as it were. So please tell us what are the things we should do or we can do to make it better, to make us not have mouth odor, halitosis, or even cavities in our teeth.
Thank you. The theme for the World Oral Health Day this year is be proud of your mouth. Be proud of your mouth. If you are proud of your mouth, or you want to be proud of your mouth, you will not do things that are um, damaging. You will not engage in habits that are damaging, untoward, unhelpful to your oral health, to your mouth or to your teeth or structures that lie therein. You wouldn't do that. You will not with a long pole or the longest pole would you touch habits that can endanger or put your oral health in jeopardy. Okay, so be proud of your mouth, and if you want to have a proud mouth, of course, the things I'm going to say following you want to engage in. What does it take to have a proud mouth? Be proud of your mouth is the theme for the World Oral Health Day for the year 2022. So, what does it take to for you to become one or a person, an individual who is actually proud of their mouth? The first thing is that when you speak or when you open your mouth or when you smile or all of that, do you have teeth that you are proud of? What is your mien, your visage, your countenance, your face, your smile, your looks? What is it like? Because as a matter of fact, that's your identity card. Nobody has said that you should do a passport and they ask you to snap your behind. Nobody has said you should do a passport, a photograph for identification, and they have told you to snap your chest or any other part of your body for that matter. It's always somewhere around the head. Okay, and then what constitutes a somebody can be the very agent of hell, and then because he has a smile, it easily connotes immediately connotes a nice person. He's wearing a nice smile, a beautiful human being. Okay, whereas his personality can be the complete opposite. Okay, so what we're saying in essence is that your teeth, your smile, your looks, which your circumoral musculature and teeth and oral environment are part of, they go a long way to tell the person you are or give you a good personality or picture, or form positive opinions about you in the minds of a huge many. Okay, so having said that, we want to start from first principles. When you wake up in the morning, what do you do? If you are the type that takes breakfast, then take your breakfast and brush after. And that is easier to do if last night you brushed last thing after dinner. Last thing after dinner. Okay, so brush twice daily after meals, after breakfast, lunch may not be easy because it's in between and you are in the middle of work. We're not saying people should arm themselves with dentifrices to work. To keep it simple, I always say, do what works for you, keep it simple. So you may not need to go the extra mile to be brushing in the afternoon after lunch, but brush, suffice to say that brush after breakfast and after dinner. The reason is that those long stretches of hours of work, either after dinner or after breakfast, are not don't give room, because the deed is done over several hours, day in, day out. They don't give room for bacteria to have food remnants in your mouth to fester on. It is the food remnants in your mouth that that they feed on, that cause the havoc. Okay, it is the patient, is the person's, the individual's choice. But what I do for patients that are susceptible to tooth decay, very susceptible to tooth decay, I say brush, but don't rinse out. When you rinse out the entire fluoride. Only a minimal is left, a very infinitesimal passive minimal, which may not be active enough on the surface of the teeth. But when you brush and you don't rinse out, especially when you are satisfied with your brushing, you are not satisfied, you can rinse out, rinse your toothbrush, and put another round of paste and brush again. Okay, and the final analysis, don't rinse out. What you have just done is to day in, day out, morning and night, leave remnants of fluoride on the surface of your teeth. And fluoride is fantastic because it replaces the hydroxyl ion in the hydroxyapatite that gives you, in quote soft teeth, whereas fluoroapatite, when it has kicked out the hydroxyl ion, gives you, in quote, the hard teeth, mineralized teeth, teeth that are resistant to decay. So those first principles are what we should take note of. Once you have formed that as a habit, then there is an adjunct to toothbrushing, like flossing. I would advise that you floss, then brush. Flossing is using a stringed instrument to remove food particles, strands of meat, etc., stanched or trapped in between the teeth. We call them the interdental spaces. When you remove them, toothbrushing may not be able to do that. Then you now brush your teeth. That may be the reason why somebody has brushed his mouth, but the mouth is still oozing after a few hours, because a lot of things are stuck in between the teeth that the toothbrushing cannot bring out. Of course, when you brush your mouth, don't forget the tongue, especially the posterior, the last one third of the tongue, because therein lies a lot of deposits on the tongue. The tongue is like a big rag, a towel. People brush, but they forget their tongue outrightly, or they brush the tongue and forget the posterior one third. Of course, you won't also blame people, because when you have just eaten and we say you should brush after eating, there is the tendency that you want to retch, you want to vomit when you take your tongue to those parts. But if you are gentle, thorough, painstaking, you feel that it's inciting you to vomit, you stop and go back again. You stop and go
Yes.
back again until you are satisfied yourself. When your tongue is even clean in that part, you will know, you will feel it. You will feel it in yourself that that place is clean. Okay, so having taken care of the baseline habits and oral hygiene, the question is, what do you now put in the mouth in terms of food? What is it that you put in your mouth? What is it that you consume? How do you consume them? When do you consume them? What do you do after you consume them? Okay, so what is the food you put inside? If they are all carbohydrate-based sugar, refined sugar products, and all of that, acidic in nature, either from the factory line or from nature directly, you're going to have issues. For instance, if you take a lot of acidic juices from fruits directly or from the factory, there is tendency to suffer to suffer what we call tooth wear lesion, the one we call erosion. Is it appears in quote I say, it appears as if the acidic content in these juices that are good for your body, for you to take these sweet things, is not a problem. People are allowed, people should live their life and enjoy their life. It's not a problem. Some people say don't take this, don't take that. No, 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 I don't say don't take. Moderation is what is key. Moderation. People are other doctors, physicians are concerned with non-communicable diseases like diabetes, hypertension, and the rest of them, especially diabetes and all of that, because of the factor of diet. Okay, so I would just say moderation is the key, because we live in the world where all of these things are around us, and it takes a lot of discipline not to take them. But for me, my own purview is what it does to the teeth. Fruits, you can squeeze them out, especially where you have sensitive teeth. There are like citric acid. Okay, if you squeeze it out, and like people do, what do they call these things now? Smoothies and all of that. Squeeze it and you blend it very well, or you just have only the juice. You can use a straw and suck, and it delivers it to the base of the throat instead of having it all over your mouth and the surface of your teeth. Because after several years, for some people, depending on the kind of teeth you inherited, it tends to, I'm using the word very carefully, in quote, melt away the surface of your teeth, erode them. Okay, what we call erosion, one of the tooth wear lesions, as a result of the kind of juices you are taking. You can wear away the surface of the teeth. I also pointed out just by your tooth brushing. Okay, that one is abrasion. Okay, and you can still wear away the surface of the teeth by what you use the teeth to chew over time. That one is attrition. Okay, so I was saying that just use a straw and deliver to the base of the throat, and you can swallow the juice. You can take plenty of water after, so it washes away this. So they have no, I can't say no contact, they have minimal contact with the surface of the teeth and save you from erosion. So when you do this, I mean, that's fantastic. Then the last one is that you visit. You can tie it to your birthday. You can tie it to a festival seasons, end of the year, your birthday, your wedding anniversary. Okay, you go with your family, your wife and yourself. You visit the dentist. You have examinations done. You have scaling and polishing done. If there are holes in your teeth, they are nipped in the bud. If you are suffering one thing or the other, and you're not aware of it, the dentist tells you how to nip it in the bud and what he will do about it, clinically speaking. So these are some of the things we can do to have fantastic oral health.
Thank you very much, Dr. Arogunre. It has been really, really enlightening. You've been able to talk to us extensively about things to take note of, especially the very, very common ones. Really appreciate you for coming. Thank you very much. And we look forward to having you here some other time where we can talk about some other things as regard oral health, because at the end of the day, there is more to oral health than just the teeth and halitosis. Thank you very much for joining us, Dr. Gbenga Arogunre.
Thank you so much, Oluwaremilekun. I'm grateful. It's lovely to be here. I appreciate the invitation. Thank you.
Thank you, sir. Our dear listeners, you've heard it directly from the dentist, Dr. Gbenga Arogunre. Aside brushing your teeth regularly, you should also learn to visit the dentist regularly too. Yes, for the brushing of your teeth after meal, morning and night, it helps. And it goes a long way in helping you keep a healthy oral health. In the spirit of the World Oral Health Day going on, please do take note of this and make it a part of your life so that, like I used to say, we are going to have generally a healthier life. Thank you for joining us today once again. Have a great day.